So I'm Dost Öngür. I'm a psychiatrist and chief of the Psychotic Disorders division at McLean Hospital and professor of psychiatry at Harvard Medical School in Boston, Massachusetts.
This is Dr. Lorenzo Norris, editor-in-chief of MDedge Psychiatry. Today we have Dr. Öngür with us from Harvard Medical School, who will be speaking with us about the mental health effects of COVID-19. Please stay with us and listen to this informative discussion as we continue to deal with all of the far-ranging consequences of the COVID-19 pandemic. Dr. Öngür, welcome to the MDedge Psychcast.
Thank you very much, Dr. Norris.
So Dr. Öngür, we're now, depending on how you view it, I mean, at this point in time, I guess we could call it the third wave. Some people might call it the second wave. I would probably say that we're in the third wave. You could also rename it the variant phase of the pandemic. But regardless, I think one thing that is indisputable, depending on the timeline, is that we are actually very close to the, if not already marking the year anniversary mark of the pandemic. We are over documented 500,000 deaths in the US at what I would say at the minimum. And we are now starting to see and realize some of the mental health effects that people have talked about and predicted. Really, they're starting to come out now. So Dr. Öngür, can you please tell us a little bit about where, from your vantage point, what are you seeing in terms of the mental health consequences of COVID-19 to date?
It's been a difficult year, hasn't it?
Yes.
So with COVID-19, there's really multiple ways that mental health can be affected. The first and the most direct one is the effect that the virus has on people who've been infected and survived COVID-19. Because COVID-19, of course, infects the lungs and the rest of the body, but it also has effects on the brain. So there's an emerging picture that a lot of people who've experienced COVID-19 are now experiencing long-lasting psychiatric symptoms like depression, anxiety, fatigue, and so on. So that's one aspect of it. Of course, that specifically concerns people who had the experience. Then there is all the death and destruction that people experience in our society. People losing loved ones or seeing loved ones get very sick and fearing the death. Those are traumatic incidents. And as a society, it's going to take us time to recover from that. And a lot of people now, as you said, with 500,000 dead, a lot of people in our society have experienced this loss. And so that's taking its toll, and that's having its effect on mental health as well. The grief, the trauma, and the mourning. And finally, there's the effects of the lockdowns and all the mitigation efforts. Society has changed in so many ways. And of course, we've all had to adjust how we live our lives. Those who could afford to have stayed home, many people who couldn't afford to had to go to work and earn a paycheck, but feel the stress of being at risk for the virus and so on. So all of those things, the way society changed and all the lockdowns and the quarantines take their own toll on mental health. There's a lot of evidence now that in particular for young people, the isolation, the lack of social interaction is actually generating more anxiety, more depression, and also more substance use. So alcohol consumption and consumption of other also illegal substances have gone up during the pandemic. So there's reason to be concerned that mental health is deteriorating broadly for society.
Well, absolutely. I wanted to go back to a couple of things that you said. One, the long-lasting effects of COVID-19. This is not, we've learned so much about COVID-19 and this virus over the year, but this gets into really another reason why people need to really strongly consider taking the vaccine. And I'm an advocate of taking the vaccine. And yes, the vaccine has been, it has been authorized for emergency use, but recovering from COVID-19, any of you who have had the opportunity to treat patients who have had moderate to severe illness with COVID-19, this is not in any way, shape, or form, you just bounce back after 1 to 2 weeks. The effects of this are significant, and as Dr. Öngür just pointed out, just in regards to COVID, thinking of COVID-19, not thinking of it really, it attacks multiple systems in the body, and the inflammatory response can have very long-lasting consequences, which I'm sure that we are just now, I'm absolutely positive, we are still, this is an actively emerging field. So that cannot be understated in terms of the vaccination, if for no other reason than to even if you don't think that you are vulnerable to death from COVID-19, just having COVID-19 in and of itself has a great number of sequelae. And then you touched base on the loss, the people feeling loss of loved ones, but also the isolation. I'm particularly concerned about, I'm speaking as a father with 2 young children, and people, long listeners of the Psychcast will know that. But when you talk about the effects of the quarantine, we are really starting to feel that, Dr. Öngür. We are really starting to feel, I can't speak for you, but that effect of just, I have some thoughts about what it is, but hitting that year mark, it just felt like, oh my goodness, this is hard. And my kids are actually like, and it's not cabin fever. It's more, it gets into a little bit of that disillusionment phase of, if you will, the emotional response to disaster. And it is tough. I mean, can you speak a little bit in regards to just a little bit more in terms of what we're seeing in terms of the symptoms when we're measuring symptoms across the country in regards to COVID-19 mental health symptoms and where we're at?
Yeah, I mean, it's really concerning. There was a relatively large survey that was published late last year. It was actually sponsored by the CDC, the Centers for Disease Control, and it was a representative survey of the U.S. population.
Yeah.
So it was sort of like those opinion polls where they sample, enough people from society to get a general sense. And what they saw was that complaints of depression and anxiety have shot up. Fully a third of all Americans said that they were having symptoms, like clinical symptoms, feeling depressed and anxious. And then about 20% of all Americans said they actually thought about death and dying in the past month. And that number was more like 25% in people younger than age 25. So in young adults, thoughts about suicide are that common now. And this is an aberration. It's not usually like this in our society. And we really have to be concerned about this. I agree with you. There is this, the longer this drags on, especially for young people, there's sort of an emotional numbing. It's not really anger anymore, or it's not, struggle. It's kind of this emptiness that a lot of young people report. And it's really concerning. Of course, humans are resilient. We're gonna survive this, and people are gonna bounce back. But it's gonna leave scars. And for some people, those scars are gonna run deeper than others, and we have to worry about that. And we have to take care of those people.
Okay. Dr. Öngür, I agree. And let's just really start to go back to what you just said in regards to suicide. What are we seeing right now? Because there's been a lot of talk, not a lot of talk, a great deal of concern about, if you will, the echo pandemic or the potential increase in suicidality secondary to pandemic related factors. What are we seeing right now in terms of the evidence base and the science, as best as we know right now, in regards to suicide?
So that's a great question, and it's a very interesting picture that's emerging. So like we've been saying, there's no doubt that distress has gone up. People are reporting being more distressed, more depressed, more anxious, and substance use going up, and more report of suicidal thinking. Yet, when we look at numbers of deaths by suicide, and we have decent reporting on this now from the past year. In the early days, it was a little confusing whether this was happening or not. But now we have enough of a picture that's emerged that in the United States and in most other countries around the world, the number of suicide deaths, so completed suicides, have not gone up. So people are not killing themselves in larger numbers in 2020 compared to 2019 or 2018. That's of course a hopeful sign. That's a good sign that there is, of course, distress, but there's also resilience. So people must be finding ways to get some support to keep themselves safe and not take that step. There are a few exceptions. One is Japan. Interestingly, there has been some reports that suicide death numbers have in fact risen in Japan during the pandemic. We don't really know now yet why that is. It's a little early to have all the factors, all the information in. And then there have been a couple of small studies within the US, like in Maryland. There was a study that suggested that suicide deaths have ticked up a little bit among African Americans specifically. And that's concerning. especially since COVID hit the African American community particularly hard. And now there's a debate about vaccine, for example, that's going on, reaching the African American community and making sure that people are protected. So for all those reasons, we have to pay attention to suicide. But so far, that's actually a bright spot, that the resilience is there and the suicide numbers have not risen.
Okay. Let's talk about that. And two things. There certainly can be some resilience factors or things that are there that maybe we don't completely understand. The other thing that you just talked about, potentially populations that were already or populations that increase vulnerability to contracting COVID-19, and then consequently some of the mental health side effects. I actually want to focus first on some of the resilience factors or things that you think, again, nobody, this is still evolving, but something that you might think in terms of your clinical expertise, something that you might be thinking about that, this may help us think about why we're not seeing this increase, at least at this present time.
Yeah. Well, as you said, it's evolving. It's hard to know exactly. I expect that families play a role.
Okay.
Because there is social isolation. So the broader friendship networks or the broader families may not be available to people. But of course, there's still the more local, the narrow networks of nuclear families and maybe some close friendships that are still there. And then the other piece is more people are receiving care. So there's actually been more psychiatric care. And of course, on balance, that should be supportive and helping people cope with their symptoms. So more people are getting therapy now than they did before the pandemic. And that probably is a protective factor as well.
Okay. Dr. Öngür, now I'm gonna, because for the audience, Dr. Öngür, and he can correct me if I don't get some of his titles here correct, but I'm just, because you said something I thought was very important. Dr. Öngür is the he's the chief of the Center for Excellence in Psychotic Disorders, as well as the director of the Schizophrenia and Bipolar Disorder Research Program at McLean Hospital. So bottom line is Dr. Öngür has been doing a lot of research. He does a lot of work. He does a lot of scientific work. But he said something that was very important. He talked about the role of family. And I was just very curious in your own work, Dr. Öngür, in working with schizophrenia, bipolar disorder, first episode psychosis. Is that something that you just have seen in your own work, and that could have been a reason why you immediately thought about it in terms of the pandemic?
That's very insightful. Absolutely. That the research actually bears this out. The biggest factor that determines outcomes in people with first episode psychosis, so when a young person is first getting sick and they're experiencing psychotic symptoms, is the involvement of family. If family is involved, that is so protective in so many ways that you can't always quantify. Who takes you to the grocery store, who reminds you to take a shower, who talks you down when you're feeling really upset and really distressed, maybe hearing voices, maybe becoming delusional. All of those things are the people immediately around you, people in your life. And so we know that from the science, that's actually a protective factor and it improves outcomes. And I think, in the pandemic, when people actually don't have anywhere else to turn, but they're actually in their family environment. Of course, the family environment matters a great deal for some people when there's unhealthy family situations. That's not going to be supported. But on average, family involvement has been a positive. And that's why I think in the pandemic, that's probably operative, just like you said.
And Dr. Öngür, in terms of the research that you all do, you use a number of different if you will, techniques, including brain imaging technology. I was curious, and we're going to get this back to the pandemic. Do you find that if patients with schizophrenia or bipolar disorder, if you measure or have robust family support, can you see any difference in the cortical brain networks and the processing of how they deal with daily stressors?
That's a great question. So ironically, we know from the clinical side about the involvement of the family, but in brain research, that has not actually been focused on a whole lot. So I have not done work on this. There's a small amount of literature out there that actually shows immediate changes, like moment-to-moment changes in brain activity and brain connectivity during social interaction. and during supportive and experiences, supportive interactions. So there's a little bit of evidence that the brain activity changes when you're being supported by somebody who's important to you. But I haven't done that work myself, so I'm not going to take credit for it.
Okay. Well, I just found a lot of your work very interesting. And the other thing that we won't be able to get into it, but you started the conversation with this, the effects of COVID-19, and we're just now trying to understand what those effects are. Because I know some of your research involved, if you will, looking at if I want to say the function of ATP in
Right.
the brains of folks with schizophrenia. And if I'm thinking about this correctly, you found that ATP synthesis in individuals with schizophrenia was 22% lower than in the general population. And why are we bringing this up? Because I think it's important. Diseases and viruses have very real brain effects that, if we're able to get down to the neuro or the biological level, can help us start to understand really maybe some of the things that we're seeing. So I just bring that up for any comment that you want, Dr. Öngür, because I found it very interesting.
Yeah, great. So as you say, ATP is the energy molecule. Yeah. So this is really about whether the brain has the energy in the right amounts to do its job. Just like your muscles need the energy to go up a flight of stairs or to go for a run, the brain needs energy to process information and to understand the world and to regulate your emotions and so on. And our research has been showing that the synthesis of ATP is actually down, just like you said, in people with schizophrenia. In people with bipolar disorder, it's actually a little less so. So the bipolar brain is not as abnormal in this energy way as a schizophrenia brain is. But in bipolar disorder too, there are some abnormalities. And what this must be doing is it's actually impairing the neurons from doing their job. So neuronal activity becomes abnormal because the energy isn't there. It's sort of like being fatigued. If you've gone up a bunch of flight of stairs, you can't keep going because you start to get tired. That's where the brain of somebody with schizophrenia is at baseline. Even though they're not, working hard, the brain doesn't have enough energy.
Right, and that's interesting. It's kind of like being fatigued. And anybody who's listening right now, if you, again, going back to what Dr. Öngür and I were talking about, in my mind, if you work with individuals recovering from moderate to severe COVID, I would think that you will find that many of them will talk about feeling fatigued with cognitive activity, particularly if you've had the opportunity to work with someone in a cognitively demanding task. And I will say, whether you're in the health professions, nursing, physician assistants, doctors, take your pick, sales. I mean, anybody with a high cognitive demanding task, my experience has been folks have actually reported like they just don't get back to where they were. And also, let me say, in my mindset, this is a bit different than what I've seen in people recovering from a delirium. There are definite parallels. There's definite parallels in my mind, but it's different. So I think that Dr. Öngür gave us some really, again, we have to take what we know about diseases as we're learning more about COVID-19. Now, Dr. Öngür, given where we're at, all right, we've got, this is where we're currently at in the pandemic. What thoughts from your vantage point do you have in maybe thinking about how can we either shore up resilience, or the other question, and I'm just going to put it out there because we asked hard questions. We have not had an increase in the suicide, the rates of suicide yet, per our evidence, depending on where you look. Now, we did talk about the different populations, but are we basically just sitting on a really big bomb waiting to happen? And I don't know the answer to that. My gut is kind of, for various reasons, very concerned when we point to all of the evidence. And I know I just asked you a compound question, but the first thing is, what can we do perhaps to shore up some different levels of resilience? And then the other thing is, what is your gut as an educator, a scientist, an advocate for your patients tell you that we might be sitting on?
Yeah. Mental health and psychiatry are in the public conversation more than they've really been in the recent past. I think that's a good thing, of course, but we're going to need more of it because, some people have said, right, there's the second wave and the third wave, or the mutant wave of the pandemic, but then there's also going to be a mental health wave, and that one might be a tsunami, right? It's going to it's going to be big and it's going to last. So we really have to be prepared for that. There's a few things. society historically has not invested in psychiatry, but we need more psychiatrists, more nurses, more social workers,
Mm-hmm.
more therapists, more counselors, more services, because more people are going to need them on
Mm-hmm.
average. Maybe it's not going to be everybody in America, but more people are going to need it. And we don't have the services. Services are underfunded. They are typically the first to get cut when budgets are tight. The reimbursement is not good. So we have to actually invest in this if we want to get a return from it. So that's one thing. The second is we have to continue this honest conversation. I've always found that young people are better at talking about mental health and issues than people my generation or older. But we got to keep that up, because that kind of openness is going to be critical, because it's it's in the sort of the loneliness and the darkness that these bad thoughts really flourish. And if somebody can actually have the courage to go get help, that's going to turn things around. So that's another thing. It's not just the investment, but also a change in social attitudes about being open and taking the stigma head on and saying, yeah, I had a problem and I went and got help for it. Look at me. That's what we're going to need.
I really like how you just put that in regards to, one, resources, second, honest conversation, and then also looking at the next generation, us currently, but looking at the next generation in terms of two things that I personally think that this generation, I'm talking about those like 30 and under, it could be us too, but I'm just talking about those folks. Communication and connectivity. Dr. Öngür spoke to us about potentially his thoughts about the power of family. Well, the other aspect of social media and all of these things, it does give us an ability to connect in ways that we haven't before. We just have to, we do have to, it's emerging and burgeoning, but how do we use it? Because like anything, it can be useful or it can be problematic, but we're still learning how to utilize that. Now, Dr. Öngür, because you talked about resources and you talked about we need more people in the mental health profession, like all the allied, if you will, professions. And I'm glad you mentioned a number of people, because I'm proud that in our Psychcast we have an interdisciplinary audience of a variety of folks. But here's something I want to ask you. How are you all doing at McLean? How are you guys doing at Harvard? I mean, how are you all keeping your energy and your spirit and your resilience up in the face of this pandemic?
Yeah, it's been a stressful time. I'm not going to say that, we're doing great. But, like many places, a lot of people in the audience, of course, work in busy clinical services. McLean has lots of busy clinical services. That's what keeps people going. And for example, on the inpatient wards, the nurses, the social workers, the psychologists, the doctors working together, they're full. The wards are full. And there's people in the emergency rooms waiting to come in. It's been a time of real busy clinical work. And that creates its own kind of camaraderie, right? Because when you're working together, it helps keep people going. We've been trying to do things like, having lunch together outside when the weather is nicer. We did more of that. Of course, Boston weather in the winter isn't easy, but in the summer and fall last year, it was a little easier. Trying to just maintain that camaraderie, keep people together. But it's been stressful. It hasn't been easy. And then the outpatient folks, the outpatient clinics have all been virtual. So people are working from home. They're doing one Zoom call after another, trying to keep up with their patients, making sure people are safe, they're taken care of, that there aren't any problems that should be addressed. But that's really isolating for the outpatient folks. So we've also tried to do, Zoom parties, like we had a holiday party where everybody got on together. And I talked to people I hadn't seen in 6 months, because you don't see people in the hallways anymore. Everybody's sitting at home. So it's been a stressful time. We're not going to go, you can't really wave a magic wand and everything goes back to the way it was. So I know that. But some level of normality is going to be welcome when it comes, because I'm not going to lie, this is not easy to do. And being able to talk to colleagues, see people, just feel like, you have a little bit of your life back is going to be much better.
Dr. Öngür, I completely agree with you. We started off the conversation and I was saying that when I recently talked with a number of my colleagues, even though we gotten vaccinated, something just felt like, whew. And I think one of those things was that we need a bit, as you just said it, we need a little bit of that normal to come back. We need to be able to just see each other in the hall, or just even if it's like a day or two, because yes, our work gives us purpose and drive. And when I'm in the hospital, I feel a sense of purpose. But when I'm in the medical school, I don't know what is, I assume it's like this at Harvard as well as other schools across the country. A large portion of the medical school is completely empty. There are not people in the halls. It's basically like a Twilight Zone episode, and I'm used to it now. But it's myself, a couple of others, our dean at GW, Dean Bass. She comes in religiously, but we're separate in separate offices. So I really like what you said. I mean, a bit of normality, and the ability to, with that bit of normality, to hopefully reconnect with folks that we had lost track of, but now we found again during the pandemic, would be most welcome. And I'll tell you, it's been a pleasure talking to you, Dr. Öngür. One of the biggest things I'm going to do, I've talked with so many people on the Psychcast, I'm making it a point. Our editors, Gina Henderson and Jeff Bauer, might not let me do it, but I'm going to go visit everybody. I'm going to start doing in-person Psychcasts. I'm like, they won't even have to, well, I shouldn't say they won't even have to pay me for it, but they won't. I will just come. I'll be like, Dr. Öngür, I'm here. Let's go. What do you want to talk about? Let's get a cup of coffee, or show me your program, anything, because we need that type of connectivity. So, Dr. Öngür, I want to thank you so very much for appearing on the Psychcast. And I just want, are there any final words that you want to share with the audience?
Take care of yourselves, take care of each other, and stay well. And thanks for the invitation, Dr. Norris.
All right. Well, we look forward to having you back, and hearing a bit more, hopefully, about as I mentioned before, the audience only got a taste of the work that you're doing, many of the exciting things that you're doing, and I want the audience to know about what leaders like yourself are doing in the field of mental health. So thank you for joining us.
Thank you very much.